So brainstem, as you are all aware, if you are asked what is brainstem, brainstem is nothing but a relay station similar to the thalamus. If you can remember thalamus while I was discussing it, I also discussed that thalamus is a relay station where all the impulses or informations from outside your own body, from the external environment, they carry such information through your skin, muscles, and so on and so forth to the cerebral cortex. Similarly, from the cerebral cortex down to a different part of the body, motor information, goes from the cerebral cortex through the thalamus. Similarly, the same with this. So the brainstem is a relay station for conveying all these informations, either sensory information or motor information, to and from the cerebral cortex. So information, they go to the cerebral cortex, and from the cerebral cortex to different part of the body through the brainstem. Are you clear? So that is a brainstem. Brainstem, generally is made up of 3 parts. We have the midbrain, we have the pons, and we have the medulla oblongata. And each of these 3 parts of the brainstem, each one of them has or houses certain, cranial nerves and other common, structures that pass through the entire length of, the brainstem. When you now take the midbrain, there are some important structures in there responsible for vision and audition. That means vision and hearing. If you can remember your midbrain very well, we have our superior and inferior colliculi. Superior colliculi responsible for the vision, and the inferior colliculi, participates in, hearing, So it's like the vision and hearing, superior and inferior colliculi are responsible for, these 2 stimuli, visual and, hearing or auditory stimuli. Apart from that, that oculomotor nerve, the 3rd cranial nerve, and the trochlear nerve, the 4th cranial nerve, all of them, they originate, their own nuclei originate from the midbrain. So these 2 nuclei is 2 nuclei that give rise to these 2 important nerves, oculomotor nerve and trochlear nerve. These 2 nerves are responsible for the supply of what we call extraocular muscles of the eye. And these extraocular muscles of the eye are responsible for the movement of our 2 eyes. Are you clear? The oculomotor, supplies most of the extraocular muscles, while the trochlear nerve only supplies 1 muscle, that is the superior oblique. And there's also another muscle, that is being supplied by another nerve, that is the abducens nerve, that is the lateral rectus of the eye. So it's like this midbrain now houses 2 nuclei of 3rd cranial nerve and the 4th cranial nerve responsible for the eye movement. And it houses superior and inferior colliculi nuclei responsible for participating in hearing and, vision or visual stimuli. In the pons, we have what we call the 5th, 6th, and 7th and 8th cranial nerve nuclei that are housed in the pons. So pons serves as a bridge between the midbrain and the medulla oblongata. Midbrain above and medulla oblongata below. So the pons is in between, like a bridge. When you want to cross a river, you have to pass, above the bridge for you to cross. And so all this information we're talking about is coming from the cerebral cortex going to the spinal cord. They must pass through the pons. Similarly, those information from our sensory informations, pain, temperature, proprioception, vibration, sense, and so on and so forth, they all must pass through the pons before they finally reach the cerebral cortex. So the pons is a bridge, and it houses these 4 important nuclei. 5th, the trigeminal, the 6th, the abducens, the 7th, the facial nerve, and the 8th, the vestibulocochlear nerve. And so the medulla oblongata is one of the most important component of the brainstem because it houses what we call the vital centers. These vital centers, are the respiration, breathing in and out that we do. So the respiratory center is in the medulla oblongata. The same thing with the heart rate. Our heart beats about 70 to 100 beats per minute. And so the cardiac center or the heart rate, is being regulated by the medulla oblongata. So our heart contractions, the heart beating, is being regulated by the medulla oblongata. Similarly, our breathing pattern, in and out, breathing in and out, is also, the breathing center is located in the medulla oblongata. Similarly, the blood pressure. We have some, what we call carotid baroreceptors around the common carotid artery and the arch of the aorta. There we have baroreceptors that, sense the difference in the rise in the body pressure, blood pressure in the blood vessels. So these baroreceptors, the regulation of these baroreceptors, the blood pressure in our own vessels, is being regulated by the medulla oblongata. Similarly, the vomiting. When you are sick, you tend to vomit. So the vomiting center is also located in the medulla oblongata. And also when you eat food, you swallow. So swallowing, when you swallow now, the ability of you to swallow food without any hindrance is also, the swallowing center is located in the medulla oblongata. But the most important part of this, centers that I made mention is our cardiorespiratory center, heart and the lungs. So they are all located there. So the brainstem can be damaged. The whole of it can be damaged at the same time. That means both the midbrain, the pons, and the medulla can get damaged as a result of accident, maybe road traffic accident, motorcycle accident, bike, or tricyclic accident, so in Nigeria here. All this can cause someone to have a brainstem injury, and that can affect the entire brain stem. But somebody may likely have an isolatory kind of damage along the brainstem. Either the midbrain is damaged alone, or the midbrain may have a lesion alone, or the pons, or the medulla. So either of the three can be damaged in isolation. The other parts may be okay. So, but this is just like a general, damage of the brainstem. And so if the brainstem is completely disrupted, the person may have what we call brain death. That means the brain, the whole of the brain is dead. So we have what we call brain death. The patient may or may not survive. So in the complete damage of the brainstem, that person is definitely not going to survive, because the respiratory center, that is the breathing center, and the cardiac center, where the heart rate is regulated, have been damaged. So if there is no respiration and there is no heart beating, what happens? That person is dead. So the only way to certify somebody is dead is for you to use your stethoscope, listen to the heartbeat. If there is no heartbeat, that person is dead. And you check about this chest expansion, up, down, up, down. That means the person is able to breathe in and out. So if that is absent, the chest movement is no more. It means the person is no longer a respire. That means the person is dead. So in brain death, the person may not survive, and if he is dead, the death is as a result of these two important centers that have been damaged. But in case that the centers are not completely damaged, the person may survive for decades, but under what we call life support. Life support in the sense that the person is going to be placed on ventilator. I'm sure you are all aware of this coronavirus. When somebody contacted, coronavirus, they tend to have difficulty in breathing. They have to go to isolation center, whereby they are given oxygen to breathe in, because the breathing pattern, the breathing exercise, is affected. That there has been difficulty in breathing with person with such. So person with brainstem damage If he or she survives that, the person may likely be on life support, whereby you will continuously be on ventilator. So that ventilator is going to monitor, and assist the person in making the respiration and also, regulating the heartbeat. And so if that happens, the person is in a state of what you call locked-in syndrome. That locked-in syndrome, it means the person is alive, he's breathing, and the heart rate is going on all right, but the person is still fully conscious, he's aware of his own environment, but he cannot talk and he cannot move. You understand? So if the person cannot talk and cannot move, you get it, he can only make some response by moving his eyes to indicate what he or she wants, or by blinking of his eyelids, upper eyelids, to blink, or to move the eye, to indicate what eyes needs. So that is locked-in syndrome, and the person can survive for years, for decades, no movement at all, and cannot talk. It's just like a dead body but alive. The body is there, immovable body, and the person cannot talk, and even the breathing at times, he has to be on this assisted ventilation all the time, and if he's not on the ventilation, still the person is conscious but cannot respond well to certain, stimuli. So that is the destruction of or lesion of the brainstem, the entire brainstem, but I may likely take maybe one of each of this part of the brainstem to discuss certain features of lesion of that side. Maybe we take medulla oblongata, pons, and midbrain, and then we see what happens if there are lesion in one of this, what will happen. So let me just break here and then continue with either medulla or pons.